I remember being at a conference and we were talking about resistance to antibiotics in dermatology. In America, they have a massive problem. They use antibiotics probably not as carefully as we do. If you're listening from America, apologies if that sounds triumphalist by the Brits, but we seem to have lower levels of resistance. But it still happens, and I think if you are treating appropriately with an antibiotic and that problem is not going away, then you should be doing culture and sensitivity. I found certainly in the last few years as I was doing dermatology that I was doing a lot more culture and sensitivity because these cases were referrals. I wanted to make sure from the beginning that we weren't treating with the wrong antibiotic because the bacteria was resistant to that. Main bug that we see in dermatology is of course Staphylococcus pseudointermedius, although there is a very occasional MRSA case that we'll see. So MRSP, MRSA, if we're finding these conditions, of course we've then got to look at how we can prevent spread and so on, which is more complicated. Probably, we may find that we can't use antibiotics and we're thinking about using shampoos and the like, but do not forget to use culture and sensitivities in those cases where you don't seem to be making the progress you should be. And certainly if it's a second opinion from another practice, it's well worth considering doing culture and sensitivity very early on in the process before you've given any more antibiotics. Thank you.